Hello, I'm John Humphreys. I'm the Executive Director of the Association for Equity and Funding, and I'm happy to welcome you to our ongoing series about school finance. Today, we're going to be talking with Chad Trowbridge. Chad is the Executive Director of Business Services and Finance in the Chippewa Falls Area School District, Unified School District, I should say. Chad is widely known as an expert in school finance and has led his district in making numerous improvements in their health insurance model. The Chippewa Falls Area Unified School District considers school finance one of the most important strategies to a successful strategic plan, and the district is constantly assessing the educational system to prioritize resources so that the needs of all students can be met. So welcome, Chad. Thank you for joining us today. I'm going to go ahead and go off screen and mute, but everybody should feel welcome to ask questions as we go along. And if there's anything that you need, Chad, as we go along, I'm happy to help. Thank you.
Thank you, John. I appreciate the opportunity to talk through this. This is a journey for us that has been, I would say, a fairly unique one. We've been working diligently over the past, probably close to 2 decades now, trying to explore ways to stave off the growth in health insurance costs. So what I'm going to talk about today, I guess I just want to say isn't the end all in terms of solutions to healthcare costs, but it's a lot about our journey and what we learned over time and kind of getting us to where we are today, which in our mind is a success story. So I have to first start out by giving credit here to our HR department here in the Chippewa Falls School District. Although I'm the one presenting and talking about this today, they certainly are instrumental and have been instrumental in a lot of the successes and challenges that we've faced with our health insurance area. So why is this so important? What we know is that employers are the largest purchaser of healthcare in the United States. We as employers provide benefits for over 153 million people. Plus, there's very high interest in how we can use purchasing power to improve quality, to reduce costs, but also to improve our healthcare system. We have good reasons to keep our staff healthy. As we've learned throughout the course of the pandemic here, having our employees being able to be at work is a blessing for us. But for us, every employee contributes to our mega statement in some way. So we want to make sure the people we hire are healthy and they're able to be at work. When we look at our healthcare process, we want to make sure that we're treating the whole person. There are some things here that we can help control a little bit. There are some things that are outside of our reason, or outside of our ability to manage. So just to give you kind of a feel for treating a whole person in terms of their overall health isn't just about medical care. It's about biological, psychological, social, and spiritual wellness as well. For us, it's trying to find out what our people need. When do they need it? What are the measurements of care? And who can provide it at the right price? So for us, we are a self-funded district. What does that mean? There's 2 different ways that you can provide health benefits to your staff. One is through a fully insured carrier. There are many of them throughout Wisconsin and the US that you simply pay your premium to. They process all of your claims. They pay all those claims based on your plan design. And then when they look at your annual increases or decreases, they raise or lower your premium based on what your claim trends are. This can be very competitive, certainly within many regions of our state. But ultimately, they're really how you design your plan and what your costs are in your region are really what drive how much you pay in terms of premium. So we're a district that's self-funded. So if you're not familiar with self-funding, what self-funding means for us is essentially that we are taking on kind of the role of a healthcare provider or an insurance provider, but subcontracting people to do that work for us. So essentially, we pay our own premium. We put those premiums into a fund, if you will, and then from that, we pay certain expenses out of that fund. We hire a third-party administrator to process our claims. We buy something called stop-loss insurance. So if, for example, you have to have some level of protection. We all know that what was considered to be a catastrophic claim years ago probably has grown in cost exponentially over time. But for us, we buy stop-loss insurance for claims over a certain amount. I use 100,000 as an example. That's a very common amount. Our stop-loss insurance is 130,000. So any expenses incurred by one individual over that 130,000 in 1 year, we've got another reinsurance that helps pay the cost of that. We hire a pharmacy benefits manager, so they handle all our prescription drug claims. And then one of the things I guess that it seems to be a barrier for people or for entities that are thinking of getting into the self-funding business, you have to establish a claims reserve. So what that means is, like, when you run out your claim period, some of you are probably on a calendar year. If you're a school district, you're probably either on a calendar year or a fiscal year. Some entities, some businesses run different fiscal years, but typically ours are a calendar year, January 1 to June 30th, or a fiscal year, July 1 to June 30th. When you hit the end of your claim year, so I'll use June 30th as an example, there's still a lot of claims that are in process, or people have received care, they just haven't been billed for it yet. So for us, we got to make you establish that claims reserve so that when the plan year ends, you have money to pay those claims that you've incurred, you just haven't been billed yet. So the question in all of this is, what do you save? So an insurance company has all of these same services built into their process. But what we take out by being self-funded is an insurance company profit. Typically, that is at least 10%. As a general rule, to become self-funded, experts say that you should have over 200 employees as your target to be at the sweet spot, if you will, whether or not self-funding would work for you. But there have been successes with higher and lower employee numbers than that.
Chad, before you go on, I just wanted to ask a quick question, a couple of things. Do you know why 200 is the target? And I look at that 10% profit number, and it was kind of interesting and eye-opening for me that what I understood from our health insurance when we were getting bids was that they basically just looked at what you cost them in the last year or two, and that was your bid plus 10%. And so I just wonder, why the 200 employees, and could this model work for a smaller district?
Well, it can work for a smaller district. And I guess that I think is just a benchmark that the industry uses, because there's some efficiency here in hiring the third-party administrator, the stop-loss insurance, the benefits manager, just making sure that, there's going to be cost, and it's typically on a per employee per month basis. They're probably going to charge you a little bit more if you have fewer employees. They might charge you a little bit less if you have more employees. So making sure that their risk is covered too. So I don't know if that's a fair response, but that would be kind of my take on
yeah, I get that. And do you think that the stop loss insurance, is that something that even for a small district, if they were with an insurer, would that be something that would potentially protect their rate, so to speak?
It's really more specific to individual claims, but could help, I guess, if you have a number of catastrophic claims, it could prevent some sort of major loss in any one given year. So why are we doing all this? For us, we looked at this as purely a business objective. One of the things that we wanted to do is decrease our medical claims and spending. We wanted to promote wellness. We wanted our employees to be at work. Being self-funded, we wanted to make sure we were in a sustainable position, making sure that we're not providing too much funding and having a surplus at year end, not underfunding and having a deficit at year end that has to be covered somehow. making sure that we're trying to, project our claims as best we can so that we can target those premium amounts. Provide an additional benefit for some of our lower paid employees. Many of us in schools have some sort of threshold for when employees become eligible for health insurance. The Affordable Care Act changed that for all of us, and it made another hurdle for us to overcome in order to be able to provide that. And then I guess just stop putting all of our money into healthcare and allow for some spending in other areas. So when we looked at our trend, we were seeing this pretty consistent trajectory here. And when we looked at this, so we started our journey back in 2014-15, where we really took and I'll get into our on-site clinic before here in a minute, but it's really what led us to this conclusion. When we looked at our claims data, so we're spending around $10 million a year in healthcare. We have about 750 employees, a little over 5,000 students here. So roughly, almost 20% of our budget was completely medical care or health benefits, I should say. And we were looking at medical inflation, and we used a trend increase here of 8.5%, which I think is relatively conservative, certainly for our region here in the Eau Claire area. But the experts always say it's somewhere between 8 and 12%. So if we annualize those costs back in comparing 2014-15 to 2015-16, this is the trajectory that we were on. I always like to compare this to, we're a district, like I mentioned, just over 5,000 students. If those familiar with revenue limits, if you got a per pupil increase, let's use $200. It's a very easy number to get your hands around. At 5,000 students, that's about $1 million a year in revenue limit increase. If you look at this trend line, the upper blue line, we were going to be outpacing that $1 million increase with one line item alone, and that's health insurance or healthcare. So that was something that we were looking to kind of stave off. That means if you put all your money into health coverage, you don't have available dollars for step and lane increase or level increase for your staff. There's no consumer price index for wages, that no other costs can ever go up. So I always like to use that as a comparison as to why we were doing what we were doing. And when you look at the difference we made over time, the bottom blue line, we're still trending downward in terms of our medical cost. And I'll share with you how we got there. So mitigating risk, that's something that we wanted to try to take a very broad approach at how we were going to do this. We created an on-site clinic. We did some direct contracting with healthcare providers. There are a couple different ways you can establish an on-site clinic. You can hook yourself up to a provider that already provides those services in your community, or you can look for somebody who's independent. We partnered up with some centers of excellence. What do those mean? When we look at specialty services like colonoscopies or MRIs or services that don't necessarily have to be done in a clinic, we wanted to see if we could partner up with some of those entities to do some direct contracting to get those services. We looked at providing alternative healthcare. For us, it was telemedicine called Teledoc. I'll share that with you later here in the presentation. We've increased our deductibles. We were a bit of a unicorn, I think, many years ago when we started raising our deductibles to meet up with high deductible health plans. But as I look around the region, I don't think there are too many districts or entities around us that don't have some sort of high deductible plan, at least as an option for their employees. It's become more of the norm rather than the exception. We wanted our staff to have easy access to preventative care. We wanted some health coaching to go along with that by using biometrics, helping our employees become better consumers of healthcare. You probably have heard that many, many times over the past 2 decades, being in control of where you spend your healthcare dollars, making sure there's guidance for our employees as employees, but also as patients. finding some low-cost care for them to make their high deductible health plan or health savings account dollars go a little bit farther. Talking again about imaging, MRIs, for example, generic pharmaceuticals, making sure that whenever there's an option for a generic, we always use that first, at least give it a try. We've had some success with a service called medical weight loss. And then for us, we got rid of, like we call it the standard plan here, but those of you that had the very traditional plans, and maybe you still do, where you have a very low front end deductible. After that, everything is covered at 100%. We moved away from that just because most people would meet their deductible, and after that, they really didn't care what their healthcare costs were. So that was some of the reason for why we started going down this path. So for us, we decided we needed a focus. What are the big three things that we could focus on? One was, we call it Cardinal Healthy. That's our on-site clinic to provide both preventative and acute care, making sure that we had a staffed clinic that people could get into and not have to wait days, hours, weeks, and months to get in to receive service. Keeping them away from, if possible, emergency care or I'm losing it now, but where you can walk into a clinic care without an appointment.
Urgent care.
Urgent care. Thank you, John. See how much we've forgotten about urgent care. Looking at our pharmaceutical costs and then orthopedic. So born out of that was our Cardinal Healthy. We partnered with an entity called Reform Medicine to provide clinic care here in one of our district buildings. So we did a small remodel of a space in one of our older buildings that could be utilized for the clinic. We created an outer office space and then 2 exam rooms. So the thought being, we want at least 2 people to be able to receive service at the same time. We staff that with a medical doctor and a nurse practitioner. And then obviously there's some nursing support that goes along with that and some outer office staff as well. So we created our own on-site clinic that our employees and their families could use on a regular basis. One of the things that drove us to this decision is this is an example of a child of one of our employees who went in for a routine physical. They got to that physical, decided they need a blood draw as part of that physical, took a look at some other things that the doctor wanted to check into. When all was said and done, that bill was $2,300. And there probably is everybody who's on this session today can probably shake their head and give an example of how something like that happened to them. You go in for something simple, you come out with a big bill. Maybe you got some service along the way that was, that certainly added a ton of value to that. But ultimately, you ended up paying probably a lot more than maybe the $150 that the physical was going to cost you. When we look at running this through our healthcare clinic, our employee would have paid $25 for an office visit. There was some lab fees on top of that our clinic can do at a much lower cost. So it would have cost the district $250 to have these same services run through our clinic versus $2,300 to go to a provider clinic. So that's an example of ways that you can kind of stave off some of those costs if you're willing to put the risk into opening your own clinic. So one of the big decisions, if you were to decide to create an on-site clinic, is what kinds of services do you want to provide at this clinic? One of the things that we were very cautious of, certainly in our region, is that there's a lot of duplication of care. I mean, for us here in Chippewa Falls, we have local providers here in Chippewa Falls. We have near providers in the Eau Claire area. We have, within a 90-mile radius, lots of providers. All these providers, some of them have specialty care, but most of them provide the same general care services to a broad audience. So when we look at what do we want to provide at our clinic, we wanted to make sure that we wanted to treat conditions and things that our staff were experiencing. So through family practice, most often you can treat a fairly wide range of medical care issues. So this is just an example of if one of our employees were going to make a doctor's appointment and they were going to decide whether or not they were going to choose our clinic or a different clinic, they can look at something like this and say, yep, what I'm going to see a doctor for would be covered here at our clinic. You can take this to any level that you want. We currently don't have an X-ray machine. We don't have an MRI machine. We don't have the ability to perform an EKG. This is really intended to be, pretty general family practice care, but guiding people in the right direction should they need some additional care. The clinic's only as good as the people that use it. So when we look at utilization in the clinic, two costs range very differently. So what we wanted to do without providing these costs in our own clinic is to be able to provide some consultation. So if you look at somebody who needs to have, in this example, an MRI or a colonoscopy, when they look at cost by reference versus cost of just going to a clinic, those reference areas, so this kind of speaks a little bit to the contracted care issue, you can significantly reduce your cost. And we wanted to incentivize our employees for doing that. Don't just go to the big box provider and have those services done. If you're willing to travel 30, 60, 90 miles, we'll give you a financial incentive to do that. And in turn, our health plan will save some cost in the process. So when we look at the first few years of our clinic, it takes some time to have an established group of patients who want to utilize your clinic. It's a big change. I mean, if you have a relationship with your own individual doctor, that's important to you. When you go try out a new doctor, there's some, getting to know you time period in there that you have to feel comfortable with. So for us, one of the things I think that has been tremendously advantageous for us is the fact that our clinic staff are the same people who started there 5 years ago. So that I think is a benefit to us. When we look at this course of time, this is the percent of our employees and also their dependents, how many times they've utilized the clinic. So we see, of the users, many have been there 1 to 2 times, some 3 to 5, but some more than 10 times. So when you look at, the cost of the clinic versus the cost of going to a provider, obviously we're able to provide those services at a lower cost. Since we started, we have seen an average savings of over $2 million. So when we look at our pricing at our own health clinic versus providing those services in the community, there is a tremendous advantage for us to do that. So when we look at, in this case, over a 4-year period of time, we saved roughly $2 million just by having our own clinic. When we look at vaccines, and who would have thought when we started this that there would be such thing as a pandemic vaccine or a COVID shot, but ultimately this is general vaccines that are required in Wisconsin for youth, whether it's your flu shot or a shingle shot, anything that you would get vaccinated for. Our clinic is able to provide those services at a much lower cost than if they were going to a community clinic. One of the things we also looked at is, where are we spending our dollars? When we looked at where all of our costs were going, what our health plan was paying in terms of cost, who was it paying those to? So you can see a look. This is our top 10 providers, or 12 providers, in our region where our staff were receiving care. So our intent wasn't really to take that care away from those providers, but make sure if they were seeing those providers, it was for the right reasons. Another thing that we wanted to look at was our prescription drug plan. When we look at pricing so this for us is a contracted service, occasionally it's advantageous to change who that provider is. Prescription drug companies have access to discount networks, and sometimes there's some complacency over time. This is an example of where in 2019, we did change our prescription drug provider. We did make some shifts in our prescription coverage as well. I mentioned a shift to making sure if there's a generic available that it was provided. So we looked at that and cut our costs in roughly half. when we looked at prescription drugs. So when you look at the value over time, we wanted to make sure that it was something that was sustainable long-term. It wasn't just a buy-in of a discount, and then we'd see some creep up of rates over time. But we see some sustainability here in terms of our contract pricing with a prescription drug carrier. Also too, we do promote prescriptions at our clinic, our Cardinal Healthy Clinic. Oftentimes they stock the generic medications, and this is something that we review pretty frequently, making sure that when our employees go to the clinic, if there's a prescription that they need that it makes sense for us to stock in the clinic, we can buy it at our provider, Reform Medicine can buy it at a discounted rate or a community or a pricing rate that is not one that is marked up. And then we can pass that through our clinic and make sure that our staff and their families are getting a low cost prescription. And to them, it doesn't cost them anything if the clinic stocks their prescription. We just run that cost through our insurance plan, and it's at no cost to the employee. It's part of their visit. So we want to make sure that that's accessible. It's very easy to get a prescription refill from our clinic. If you call the clinic, they'll fill it for you. If you drive to the clinic, they'll even walk out and hand it to you while you're sitting in your car. So very, very, very easy to use our clinic for that. Again, just looked at what's the value of us filling those prescriptions at our clinic versus if they were buying those prescriptions in the community. And you can see that obviously we can provide those prescriptions at a much lower cost than we'd be able to buy them at a pharmacy or a clinic pharmacy. The other thing we wanted to look at is orthopedic care. This was an area where we wanted to make sure that we were providing the right guidance for orthopedic care. And we contracted with two different companies to do this. So let's say you have an injury and you go to our Cardinal Clinic. Our clinic is able to make contact with MD Direct, which is an orthopedic care provider. They can look at the information that's available to them and guide that employee as to what their next steps are. So we'll talk a little bit more about what the model of current orthopedic care looks like. Many of you have probably maybe even experienced this when I talk through it, but it'll make sense to you at that time. So this is an area, like I mentioned, that we were spending a lot of our dollars on. We wanted to make sure that we could decrease our cost per patient to make sure that it made sense for us to contract these services. When we look at MSK as musculoskeletal claims, when we look at those amounts, we wanted to make sure that the people utilizing this service were getting the right value for that. So if you look at that third line from the bottom, over time, that cost per patient, although it's fluctuated a little bit, in 2021, it was really only for the first 3 months of the service. So at year end, it probably has come down. So here's a case example of orthopedic care. Somebody needed a joint repair. Employees maybe have been delaying surgery. I think we see this all the time in schools. Many of our staff are employed during the course of the school year. So it's hard for them to have some sort of surgery during the school year. So they put that off until summertime, sometimes making that situation a little bit worse. But also too, I think for the most part, being sensitive about the fact that it's important for them to be at work. So the point in all of this is to try to take out all of the unnecessary care. So if you had your own experience, you probably went, you got hurt or noticed something. You went to the doctor maybe took an x-ray, referred you to physical therapy. You went to physical therapy for a number of visits. You went back to primary care. From there, they referred you to an orthopedic doctor, sent you to get an MRI, determined whether or not you needed some surgery, went through physical therapy again, and it took you 120 days to get through this process. What the idea behind this is to deliver the right care at the right time. So by contracting with, in this case, MRI, I think is the best example. Let's take an MRI of this injury and let's make sure we're diagnosing the right problem and not spending time and money throughout the course of that physical therapy, which sometimes does work. I'm not saying that it doesn't, but making sure that physical therapy is the right answer, that we have that MRI to make sure that we know that we're treating the right symptom here. So that's where these opportunities for us with MD Direct come into play. Having the consult of a musculoskeletal expert to be able to guide our clinic provider, our doctor in our clinic, to make sure that they're sending our employees to the right place to get the right care at the right time. So some performance over time for us. We started this journey a year or so ago. We had some savings in our first quarter, but we looked at overall in our fourth quarter, roughly $300,000 that we saved our plan by contracting this service. So overall, over time, it's our belief that we'll see continued decreases when we compare years. This is an older comparison, but 2017 to 2018, we had a pretty significant savings using this directed care. Another service that we use is called Aletheius. Aletheius is a company that does some research for us and guides our employees to find high quality care at a lower cost. So I don't know, I'm guessing there are people on this webinar that are from all over the state, but when we look at our area, in the Eau Claire area, we have some of the highest medical costs, in fact, the highest medical costs in the state of Wisconsin and in our region. When our employees need service, they can get that service locally, and our plan will pay those higher costs, or we can do the research to find out where they can get quality care at a lower cost, not only saving the plan, but perhaps saving their deductible some dollars as well. So Aletheius does that for us. They do the research on costs and service throughout the region and help us direct our employees to find that better pricing within a closer proximity than just doing it locally. Sometimes locally is the better price too, but that's the research that we do so that our employees don't have to do that. And Aletheius does that for us. So when we look at those average costs, when we look at traveling just a little bit of distance here, oftentimes we can see some pretty significant savings. And we do some incentivizing for our staff to share in, to get a little bit of compensation for the inconvenience of traveling somewhere. Sometimes it might involve an overnight stay. We take care of that generally as well, but just trying to look differently at being pigeonholed into paying the costs that are just charged in our area. So competitively pricing that, I guess, is the best way to say it. We started in 2018. We saved about $53,000. We had, I think, 133 patients use this service. In 2019, 185, $141,000 worth of savings. In 2020, so you can see this has grown in popularity. It takes a little bit of time to keep it moving along, but 266 cases, 126,000 worth of savings. And in the year, just the first 3 quarters of 2021, high utilization, cost savings in the $230,000 range. Over time, since we started this, we've saved $550,000, a little over $550,000, and then it helps our employees engage in becoming better consumers of healthcare too. Because if they didn't get this information, odds are they probably wouldn't have researched it on their own. So this is just something that helps create awareness and cost savings and quality care all at the same time. Just a side note too, a great provider in our community, Oak Leaf Clinic. I think there's some pressure here to lower pricing. A lot of our employees were going to get colonoscopies in Woodbury, which is not too far from Chippewa Falls, about 75 miles away. But locally here, one of our providers have lowered their cost of colonoscopy so that our employees can go there without having to go to Woodbury. So sometimes I think that that competitive nature does help to lower cost in your specific area as well. People have a choice to go other places for that care. One other service that we also added to our plan is called Teledoc Telemedicine. It's a really fast growing trend here in America. We did this before the pandemic, so many of you probably had some sort of virtual check-in. If not, you have been to a pharmacy where you've virtually talked to a pharmacist when you got handed your prescription. Everybody's dealing with the same kind of things with the shortage of labor in the labor market. But by saving in-person visits, non-emergency patient visits, it allows time in clinics for more serious illnesses and injuries. So this concept of telehealth is to be able to receive healthcare in the comfort of your own home. Oftentimes it's a little probably more of the simple stuff. If you have a child who has a consistent ear infection, you go to the clinic, you get some antibiotic, treats the ear infection, rather than paying $300 to $500 to go get that diagnosis. If you can jump online, talk about the symptoms, and have a real doctor prescribe an antibiotic that you can go pick up conveniently, and cost you nothing. That ultimately is what leads to some better care. When we started Teledoc, we thought we could achieve some savings here to our plan as well. This is in 2017, saved roughly $143,000. So these are our employees or their dependents who use Teledoc versus going to a urgent care clinic or emergency care or even scheduling an appointment at a clinic. In 2018, another $101,000. 2019, $114,000. 2020, $88,000. So as you can see, it's not huge savings, but when you accumulate that over time and you kind of change that mentality that I can get this same service without going to a doctor or to a facility, it can save some money over time. First half of the year, 2021, very similar cost savings. So overall, we've saved almost $500,000 by utilizing this telemedicine concept. So it's worked out very well for us. There's another portion of this too. We have an EAP provider for us in our community. It's a company called Real Living. So this is another contracted service for us. Our employees get 4 free visits. They provide this care. We don't provide in our district. We don't have the ability to provide it, but they offer those counseling services or really anything, any kind of service that our employees would need. When we look at the utilization of EAP, this is a percentage of our employees who use EAP. You can see that there was quite a rise in 2019. It has consistently remained relatively high. Some of the symptoms that our employees were presenting or talking about with our EAP provider, depression, anxiety, grief, and loss were the 3 biggest ones. Throw the pandemic in there, and you can see why. I think, and many of you are probably experiencing this, not only yourself, but with your staff as well. There's so many unknowns right now, and it has really been hard on our staff, our employees, to get through the pandemic as well. So mental health is something that all of us have been talking about for many, many years, and depending on the community you live in, some of it gets ignored. But I think I can honestly say over the past 5 years, I've heard more about mental health conditions than I know I did for probably the first 80% of my life. But it's something that I think more and more effort is being placed into providing mental health support where it perhaps wasn't available to our community as it is, as available to our community as it is now. So again, promoting mind-body practices. So whether that's through our EAP provider, another thing that we do is we offer on-site chiropractic care. We just contracted with one of our providers to come into our facility. So our employees schedule with them directly. We just provide them the space. 2 days a week, they come into one of our facilities. So trying to make it convenient for our staff to be able to go get that service. You can go on your prep period or you're gone for an hour or less. You don't suffer any loss of pay for doing that. So again, trying to prevent taking a full or a half day sick day to go get some of this care, allowing our staff to do that right here in our district when it's convenient for them. So for us, this comes out of in our strategic plan, our people pillar, focusing on the well-being of staff. So we want to make sure that we're providing good care at the right time, keeping our staff healthy. And of course, there is some savings involved here. So it isn't purely just a money motivation, but when you look at our high deductible health plan, here are our total plan cost over time. So we have seen some success with this. And again, this is a average cost per employee per month. Just another way of looking at this, but coming back to this chart, this I think is a very telling story of some of our success related to this. So our premiums that we set, because we're self-funded, we've increased 5% over the last 8 years. So we're a bit of an anomaly, but as you can tell, we put a lot of work into staving off those costs of healthcare, staving off that cost of healthcare, not just sitting back and allowing an insurance company to raise their rates 20 and 30% every time we do a renewal. So that's our story. That's our journey. Obviously, I'm a huge proponent, certainly of a district our size, for self-funding for health. Again, if you're taking away insurance company profit, estimated at 10%. If we had $10 million of healthcare spend, we don't any longer. We're closer to 8, 4 or 5 years later. But just taking that, $800,000 to $1 million and not giving it to an insurance company, but using it to invest in our staff and spend our dollars a different way. Happy to answer any questions that anybody might have.
Yeah, I just asked you to go back that one slide. So that's, I think, just a fascinating summary there. I guess the question I'd have, when you look at the 6.5 million to 7.3 to 8.5, what's the rate of increase there?
I haven't calculated it, but it's probably 10-ish, over 10% for sure.
Okay. So
you can't eliminate medical inflation.
What's that?
I said we can't eliminate medical inflation. That's just a
absolutely.
Reality. So,
but you clearly cut out a lot of the overhead costs, and it's going to go up. That, but you saved so much money for your district. It's pretty amazing. What did you say that the total savings in 3 years was over 2 million?
Yeah.
Yeah. And I had to just, as you were talking about the knee example, it was really interesting because when you bring the price of that MRI down from about 7,000 to about 1,000, that opens up other opportunities for guiding care in a way that's more precise, I guess, right? Because suddenly the price of that MRI becomes kind of competitive potentially with all the delays, the lost work, plus the PT care. So that was just a really interesting opportunity for efficiency.
Yeah, and I'm a firm believer that that's the right way to approach this. I'm not one to promote MRIs, but for us, we have a a digital imaging company that provides service in our community. You can schedule with them and you can get there. It's $480 for the MRI. For us, that's, you know, so if I'm paying that as my deductible, that's cheaper for me than an x-ray. So the x-ray is not going to tell you anything unless you have something wrong with your bones. Generally, you know, in these joint situations, it has more to do with tendons, ligaments, cartilage, that sort of thing. So, you know, we just believe that, you know, if the opportunity is right, go get the MRI and make sure we're treating the right condition. And if you know right away that you need surgery, go get surgery.
Right. Yeah. And then don't miss all the work in the meantime, you get to recovery.
Correct.
Wow. Other questions from folks? We've got 5 or 6 folks on the call here around the meeting. Certainly open to others.
It's one thing that I'd add is, you know, don't be afraid to do some research on this stuff. I don't know that these are things that, you know, our current medical community is going to want to share with you. One of the things that I will add too is when I talked about replication of services in our area, we worked hard with our local providers to carve out some sort of, you know, community healthcare for our staff. And we happen to be the county seat here in Chippewa County as well. You know, let's try to partner up with Chippewa County and the city of Chippewa Falls. You know, we can drive the number of people utilizing the service up into the couple thousands. Those medical providers were not interested in having that discussion. They just couldn't. They kept coming back to us and say, we just can't figure out a way to make this work for you, work for us. So, you know, we warned them, hey, we're going to go our own direction. And if I were to give you an opinion here, I highly recommend the independent consult. You know, if you have an on-site, not to say that on-site clinics can't work if they're linked to a provider in your community, but don't be afraid to hire your own doctor and your own nursing staff and have that be independent from a referral to another clinic. You have a lot more control over where those costs go.
Yeah, interesting. Well, I think it's about time for us to close up here unless, there's Janelle.
For your presentation. I work in a medium-sized district and I've had experience in self-funding before, and I'm having a hard time convincing my district because it's relatively small. So I thought that was interesting that you were able to talk about kind of a general rule there. I was just wondering if you have any information on, you know, smaller districts where we could go to look at trends or to try to pull some of that information to show that it's viable, who we could work with to try to look at that option.
Yeah, it's a great question, Janelle, and it's one that doesn't always have a lot of available resource, but you're probably going to want to work with some sort of consultant anyway, and you probably did when you were self-funded. I would recommend maybe looking outside of your area for that consult. You know, just try to find a consultant that can guide you, not necessarily from your local area. Not that there's anything wrong with that, but you know, just look around at consultants and talk to different consultants about what your options are. Sometimes they find better opportunities than might be apparent. I guess and they can help you with some of those costs as well, finding out those trends.
Thank you. I thought that if I could get self-funded dental off the ground first, maybe that would be a good start, and then try to maybe move in the direction of health insurance.
Medical costs are becoming quite a bit more transparent. I think there was a pretty significant push for that back even 10 years ago. But, you know, sometimes you can go to a provider's website and find the cost of, you know, a service that you might need, and you can competitively shop those, but still not really as transparent as it probably should be.
Thank you.
All right. Any other questions for Chad? All right. Well, hearing none, I want to thank you again on behalf of AEF, and really interesting to hear this story. And I think part of what's inspiring to me is that your employees are getting really excellent care. And it seems like much more efficiently in many ways. So delays, proximity, the right care at the right time is kind of what you said, which is neat. You know, it's not such a slam dunk. So really appreciate the perspective, Chad. Thank you. And I know that you'll be available for questions if people have other questions. If you'd shoot me those slides, I will post those slides. And again, on behalf of AEF, thanks for your time.
Thank you very much. I appreciate the opportunity.
All right. Take care.
Yeah.